Hello, everybody. My name is Colt Huggins, and I will be talking about the effects of myofascial release on respiratory muscle function. So, myofascial release is a hands on technique that involves a low load or gentle pressure through skin to skin contact that causes changes to viscoelastic mediums such as the fascial system of our bodies. Myofascial release has been shown to be a safe and effective technique to address connective tissue restrictions in order to eliminate pain and restore motion. Why do we focus on respiratory muscle function? Well, that's because research has shown that there is a correlation with back pain and pulmonary conditions. We wanted to understand more about the effects myofascial release has on the diaphragm in hopes of finding implications for hands-on interventions that address the anatomical problem instead of medication that addresses the symptoms alone. Since there is currently limited research of myofascial release on the diaphragm, we decided to see effects of it on healthy individuals prior to looking at people with pulmonary pathologies. So we wanted to find a few things: anatomical change and functional change. We wanted to determine the effects the release had on the diaphragm using ultrasound. We also wanted to determine the effect that it had on your functional respiratory measurement. So how did we do it? We gathered healthy subjects aged 20 to 30, healthy meaning no back pain and no previous diagnosis of pulmonary pathologies such as COPD or emphysema, asthma, things like that. Functional capacity was measured with COSMED equipment to obtain forced vital capacity and forced expiratory volume. These objective measurements are indicators of pulmonary pathology and used to diagnose things such as COPD and asthma. Anatomical changes were measured with ultrasound images obtained with 4 MHz curvilinear array transducer that allows for greater sound wave penetration. Diaphragm excursion as well as the width were obtained. These measurements were taken 3 times, once at the baseline, once after deep breathing technique, and once after the myofascial release itself. So what did we find? Based on an alpha level of 0.05, the only significant difference on the within subjects factor was the FEV1 FVC ratio, so the forced expiratory volume ratio to the forced vital capacity. No changes were noted in the FEV1 alone, FVC, or no anatomical changes were noted. So what does this mean? Myofascial release, as described earlier, is used to address restrictions in the myofascial system. As we measured healthy subjects, we did not expect to see much anatomical change, if any, because they had no impairments to begin with. The decrease in the FEV1 FVC ratio does denote a decline in pulmonary function. However, we believe that this decline is likely secondary to exhaustion, as repeated testing was performed in a single session rather than 3 separate sessions. Further research is needed to determine these unknowns. First, we need to adjust protocol to identify if the exhaustion was in fact the cause. And second, we need to perform research on individuals with anatomical or fascial restrictions to determine the effectiveness of this release technique. To end, I just want to mention that Miss Deanna Berryman was our sonographer who was in control of everything with obtaining all the measurements that we had from the ultrasound, and her name is not on this poster, so I don't know why, but she was a big help in this research. Thank you.